Hello and welcome to Nara.com, the place where you find the most valuable advice and tools to become and remain holistically healthy. And today we're gonna talk about a disease that is affecting hundreds of thousands every year, and it's not very much is known about it in the mainstream media. There aren't any solutions that are very often talked about. It's very difficult to treat, and it's Lyme disease. And we're gonna talk about the history of Lyme disease, what science knows about it so far, and give you real advice on how to cure it for sure without any side effects. So without any further ado, let's dive right in and learn more about Lyme disease and how to cure it. And I would like to start with an important notice first. In this video, we're going to address this very serious health condition called Lyme disease that is a growing epidemic. And it's the underground cause for many debilitating conditions such as diabetes 2, cancer, multiple sclerosis, dementia, autism, arthritis, multiple chronic diseases, autoimmune disorders, and many more. It is very difficult to correctly diagnose Lyme disease, and many aspects of the diagnosis and the testing will be disclosed in details in this presentation, of course. And what made us prepare this video presentation for you is related to the absolute cure of Lyme disease, which you can get at lyra.com. And it's the first time that such a cure has been available to the public, and it's the Artemisia herbs extract. And we have an extra presentation on the Artemisia extract that you can get at Lyra Nara that is not your standard Artemisia extract, as it is 25 times higher in concentration and thus has a bioactivity that is up to 98% compared to the other preparations of Artemisia, so very unique. And I'm going to post the links that you see here also below in the description box, so you can just click on it and see the whole presentation on Artemisia and artemisinin. And of course you can order this special Artemisia herbs extract exclusively at Lyra Nara, and I'm going to post this link in the description box below as well, of course. And all of you who are struggling with Lyme disease and are interested in changing your life quality and finally heal this debilitating disease, we recommend to you that you use the Artemisia herbs mixture extract. And additionally, in this presentation, you're going to hear about a lot of other natural treatments that will help you alleviate your condition and actually get rid of it completely. Once again, why is our Artemisia extract so unique? Because there is no other herbs extract of Artemisia on the market that has such a high concentration in active artemisinin and thus 98% bioactivity. And it breaks down biofilms and cysts, and it eradicates bacterial, viral, parasitic infections. It's free of side effects and risks, as well as a Herxheimer reaction. It takes probably some weeks at the most to completely heal Lyme disease with this. The claims we make here, by the way, about Artemisia apply only to our unique Artemisia extract that is so highly concentrated, and will make no guarantees for other Artemisia extracts that are available on the market and are much lower in concentration. So with that being said, let's talk about Lyme disease and how you get it. So it's a health debilitating condition caused when someone develops various reactions considered to be triggered by a type of bacteria that's passed through tick bites normally, and possibly also other insect bites. So deer ticks especially, also called Ixodes ticks, and blackleg ticks carrying the bacterium called Borrelia burgdorferi are the two types of insects that many consider to be responsible for spreading Lyme disease. And experts also suspect that certain spiders, fleas, as well as mosquitoes could potentially carry and spread this disease as well. So you can also get sick when exchanging fluids with your partner, by the way, and during the pregnancy the mother can give the illness and this bacteria to the child. So the child can also become infected. So Lyme disease history: in 75, a mysterious illness causing arthritis in children showed up in the city of Lyme, which is a city in Connecticut, and adjacent communities there. The new illness was found to be associated with tick bites, and in 1981 a researcher named Dr. Willy Burgdorfer and his colleagues isolated the microbial culprit, which was a corkscrew-like organism, and named it after Willy Burgdorfer, which is therefore the name that we use nowadays, Borrelia burgdorferi. Dr. Burgdorfer noticed that symptoms of this new illness were similar to a tick-borne condition long recognized in Europe called erythema migrans, or EM for short, was named for the associated rash that was migrating from the tick bite. Physicians in both North America and Europe have long recorded illnesses associated with migrating rash surrounding tick bites, so for more than 100 years. But because they lacked effective treatment options and because the illness was debilitating but not life-threatening, tick-borne illnesses never received much attention in academia. Lyme disease is not a panic-inducing pandemic like Ebola or something like that, but Borrelia burgdorferi that causes the Lyme disease is a stealth microbe that insidiously makes people chronically and miserably ill, and often for their whole life. So it rarely kills directly, but its sole purpose is to complete a life cycle stage within its host and then hop on board to the next tick that comes along to the next host. Within its natural host, the white-footed mouse, it completes its life cycle with seemingly little harm to the host, but in humans, unfortunately, this is not the case, and we see very debilitating diseases arising from this. There is also a darker side to the history of Lyme disease, and that has to do with biowarfare. So the Lyme bacterium was first propagated in cell cultures by another CDCIS biowarfare expert called Alan Barber in a biowarfare lab. And this researcher had previously studied anthrax for the military and went on to create mutant strains of Borrelia burgdorferi. He now directs a biowarfare lab at the University of California, the Irvine campus, and as the director of the biowarfare lab at the University of California, Irvine, Barber was awarded a research contract by the NIH in 2011 to lead a Lyme vaccine research effort on an island off the coast of the northeast of the United States. The location of ground zero, so to speak, of the Lyme epidemic, and in proximity to the nation's premier biowarfare test facility that also conducted outdoor tick experiments, funnily enough. So there might be a connection there. We don't know. We want to go too deep into that, but it's interesting to know the whole history of Lyme disease. And Lyme epidemic is also perpetuated by researchers affiliated with CDC's Biowarfare Defense Unit, EIS, including Steer and Eugene Shapiro, by forcing doctors to treat or not to treat patients according to treatment guidelines that are so draconian and riddled with self-serving recommendations that the organization that put them out was investigated and reprimanded by the Attorney General of Connecticut. Lyme disease was also recently named a biowarfare agent by the US government themselves. And here you see how you could connect the dots between biowarfare and Lyme disease. So it was first discovered 20 miles only from a very famous biowarfare lab that we talked about in a previous slide. Here in Plum Island Animal Disease Center, they did auto-tick experiments for biowarfare research. African swine fever virus research was also conducted in ticks, and there's a history of leaks and major safety violations also at this animal disease center. Yeah, there is a very sinister connection here that could be made between Lyme disease and biowarfare experiments, and maybe something went wrong, the ticks escaped, or maybe it was even done on purpose. We don't want to speculate here too much and go too deep into this side of the story. We want to talk about how you can detect Lyme disease more and offer you real life solutions that can help you. So we're not going to dwell too much on this, but it's interesting to know, and here you can see all the connections. And here we can see how Lyme disease is spreading. It started with Plum Island, or very close to Plum Island BioWarFARE lab, which is the epicenter, so to say, of Lyme disease and this epidemic. And here on the right you can see how it has spread already over eastern and northeastern US, and it's spreading at an alarming rate, and more people are suffering from it. And that's why we wanted to make this video, to offer you real solutions. So let's talk about the numbers behind this Lyme epidemic. It's hard to diagnose, as we said already, and difficult to define, and no organization has any idea how many people worldwide are infected exactly, but the CDC says that Lyme disease is the fastest growing vector-borne infectious disease in the US. And it's assumed that about 300,000 people are infected with Lyme disease annually. Each year, 300,000 new infections are reported, 10 times more as previously, and with 25,000 new cases every month. And the real infection rate is supposed to be even higher than that. Most people know Lyme disease as an infection or an autoimmune disease that is caused by deer ticks. And while that is true, actually, there's more to the story. There's not all ticks are infected, and not everyone who gets bitten by a tick carrying the bacteria that causes the Lyme disease will react in the same way. Research here shows that tick infection rates vary from 0 to 70%, even within the same region. Beyond that, patients experience also a wide range of symptoms once they are infected, and this means that individual responses play an important role in preventing and managing Lyme disease. Add to that also the fact that the standard tests available to screen for the disease miss up to 35 to 50% of the cases, and it's also therefore easy to see why Lyme disease is such a complicated topic. Let's talk a little bit also about spirochets and Borrelia. So spirochets are 8 genera with 100 different species in this genera, and other famous spirochets are, for example, Treponema pallidum, which is better known as syphilis, or Leptospira. And Borrelia here is the genus, and Burgdorferi is the species. So you have Borrelia burgdorferi, therefore. It includes also Borrelia afzelli, Borrelia garini, Borrelia lonstari, Borrelia andersoni, and miyamotoi, and many other ones. And in Europe there are 5 strains, for example, and in Japan 61 strains. Very important observation here also, all microbes such as Borrelia exchange constantly DNA with each other via plasmids, and you can find Borrelia burgdorferi with properties usually found in Babesia or Mycoplasma. Thus, there are no boundaries between many of these microbes. So what are the early stage symptoms? You get a characteristic butterfly skin rash that appears where the tick bite occurred. Many also develop a rash that is shaped like a bullseye, that you can see here also on the right. It appears as a red ring around a clear area with a red center, of course, and this is considered also characteristic of Lyme disease, but often doesn't develop, so it's not a clear indicator. Not everybody gets this kind of a rash. In some cases, other rashes appear instead. Some even resemble a spider bite. A recent CDC report on Lyme disease found that about 70% of those infected show a visible rash, while other studies show the range to be between only 30 to 80%. So not everybody gets a rash. That's what makes it more difficult to detect. Some symptoms, some early stage symptoms that you can acknowledge are flu-like symptoms, especially shortly after being infected. These include fever, trouble sleeping, neck pains, fatigue, chills, sweats, and muscle aches, but also poor sleep, chronic fatigue and lethargy, digestive issues, including nausea and loss of appetite, achy joints and joint pain. In general, CDC found also that about 30% of Lyme patients develop symptoms of arthritis long term. Maybe people might also experience mood changes, including depression and anxiety. Cognitive changes are also a long-term symptom and include forgetfulness, headaches, brain fog, misplacing things, and trouble concentrating. And you can also get heart palpitations and heart arrhythmia. And after these early symptoms, you will develop chronic Lyme disease, and this has also its symptoms. In general, you have to know that Borrelia has a preference for the central nervous system, your urinary tract, your heart, and the connective tissue. And here you can see the whole list of disease symptoms from the chronic Lyme disease, starting with tooth pain, chronic infections, chronic fatigue, pain, migrating arthritis and joint pain, muscle pain, chronic flu-like symptoms, headaches, neck stiffness and creaking, Bell's palsy, brain fog or loss of cognitive functions, heightened sensitivity and agitation to noise and sound, ringing in the ears, sleep disorders or trouble sleeping, visual changes or blurry vision, floaters in the vision and eye discomfort, dizziness, instability, muscle twitching, paresthesia, tremors, chest pain, irregular heartbeats, shortness of breath or difficulty catching a breath, unstable bladder, and gastrointestinal or digestive dysfunctions. So many symptoms that all can hint to you being infected with Lyme disease. There is another problem with this bacteria, it is that the majority of patients with chronic Lyme disease also report at least one co-infection. 30% report 2 or more even co-infections. And co-infections might be other Borrelia strains, Babesia, Bartonella, Ehrlichia, Coxiella, Mycoplasma, Anaplasma, Ehrlichia, FL 1953, Microfilaria or Chlamydia. And those are opportunistic infections that also can be seen together with Lyme disease, Giardia and amoebas, worms, most common the Klapovi or lungworm, helminths and other protozoa worms, fungi, mold and yeast infections, Candida, Aspergillus, Penicillium, Cladisporium, human pathogenic viruses, most common Borna HSV1 and 2, CMV, Coxsackie, human and XMRV, strep and oral bacteria, and bacteria such as Leptospira, Treponema, and Ochrobacterium anthropic. So many co-infections that also affect you negatively are observed together with Lyme disease. Another problem with Lyme disease is that it mimics other conditions. So each person's reaction to Lyme disease is different depending on the state of their current health and strength of their immune system. There are thousands of people living today who have been bitten by vectors capable of causing Lyme disease, yet they show absolutely no symptoms whatsoever. Someone may be more susceptible, therefore, to experiencing severe symptoms of Lyme disease if they have weakened immunity, inhibited cellular function and protection, as well as environmental stressors, including exposure to mold and parasites. Lyme also mimics other diseases such as lupus, hypothyroid, depression, chronic fatigue, fibromyalgia, anxiety and panic, rheumatoid arthritis, schizoaffective disorders, MS, ALS, Alzheimer's, Parkinson's, polymyalgia, rheumatica, Addison's disease, bipolar disorders, and many, many more. So that's what makes the diagnosis very, very difficult. Some of these patients also do not test positive for having an active infection, which leads some experts to question whether or not Lyme disease is truly the cause of their ongoing symptoms. Other experts, on the other hand, believe that Lyme causes complications when the body starts attacking itself, which is a characteristic of an autoimmune disorder. Cofactors that make Lyme disease symptomatic are for sure emotional stress or trauma, mold and EMF exposure at home and work, unhealed emotional and ancestral traumas, food allergies, heavy metals toxicity, poor sleep and unhealthy nutrition, poor genetics, and Spirochets miasmas, as well as jawbone cavitation. So how do we diagnose Lyme disease then? As we have seen, it is very difficult to properly diagnose because it mimics other diseases, it comes in packages with other bacteria, the symptoms are similar to other diseases as well, and therefore a complex of tests must be completed to be really sure that a patient has Lyme disease. And these tests are first, of course, talk to the patient about symptoms and the history of the symptoms. The checkup of the neurological and physical state is a given. The patient must also be asked, inquired about a history of insect bites and rashes, direct microscopy and flow cytometry must be performed, the detection of antibodies using ELISA, Western blot, LTT, ELISpot, IgG, IgM test, CD57 test under 100 is considered also to be Lyme positive. Lymphocyte proliferation test, also called MELISA, culture of advanced labs, Dr. Burrascano test, an ART Klinkert test, and indirect tests for different lab parameters should be performed as well. And we're going to go into more detail about each one of these tests in the following slides. So, what are the tests that we have? The standard test is called ELISA or EIA. It's missing minimum 35% of Lyme disease cases, unfortunately. Then we have the PCR test, specifically for Borrelia DNA in the host's blood. However, because the microbe clears from the blood very quickly, the value of the PCR test is very limited. Only about half of individuals with Lyme disease will show a positive PCR test, so that test is not very accurate. But still, it will do you no harm to perform it. Should be limited, however, to only very acute tick bite exposure. But even then, negative test does not rule out the possibility of a Borrelia infection. Then we have the Western blot for Lyme test that relies on production of antibodies by the host immune system for different parts of the bacteria. And the Western blot test may provide a more accurate diagnosis of Lyme disease than most of the other available tests. But because Borrelia shares antigens with other bacteria, we have seen multiple positive antibodies are required for a true positive test. IgM antibodies show acute Lyme disease, and true positive tests are not that common, unfortunately. There is also a company called INCIDENCE that adds extra bands for more accurate testing, but the test is unfortunately very expensive. The newest technology for testing acute Borrelia infection is the Ceres nanotrap from Ceres Nanoscience test. This test is performed via urine sample and captures the outer surface protein from the Borrelia bacteria, and the company claims high specificity for the Borrelia bacteria and high sensitivity for picking up acute infection with this bacteria. At this time, the test is not indicated for diagnosing chronic Lyme disease, however. What are other specific tests that we can perform with Lyme disease in all of its stages? Phase 1, you can test and treat for heavy metals using hair test, urine challenging test, and Melissa test. Then you can look for environmental toxicity and allergy, and also mold and mycotoxins exposure levels. Phase 2, you can do antimicrobial tests before and during that therapy, and the antimicrobial therapy can start after successful therapy of 3 to 6 weeks, where the patient feels much better immediately and symptoms are disappearing. New tests must be performed to see if the infection is completely gone. In LTT test already is observed a significant decrease in IgG and IgM. However, this will completely disappear only after 6 to 12 months, so you must repeat those antimicrobial tests over and over. Phase 3, standard repetition of antimicrobial therapy if necessary. If the tests for Lyme and co-infections are still positive, you must start with the second phase of the antimicrobial therapy and using the following tests to determine the infection and whether it was cured or not. First would be the Western blot test, which if still positive, then you haven't eradicated it yet. The PCR, CD57, and both the C4A and the C3A levels, and whether they're elevated or not. If the ELISpot LTT remains positive and the titer stays up, the microbes are still active and you must consider a second cycle of therapy. Let's talk about general therapy concept of Lyme disease, and a successful Lyme disease treatment must address different levels. It must detect and resolve the interference fields, so scars, jaw infections, and devitalized teeth, chronic localized infections, the dysfunctional autonomic ganglia, etc. And therefore it must remove allergenic triggers from the environment and remove food allergies or resolve food allergies. Here, volatile organic compounds from carpets, furniture and paints, new cars, meth, newspaper and office printing ink, work and profession related compounds are important and must be removed. You must change your nutrition and lifestyle. So here a ketogenic diet is recommended. You must eliminate sugars, grains and starchy foods from your diet. Also, it's important to remove structural blockages. So you must optimize the dental occlusion to restore cranial lymphatic pump. The craniosacral therapy must also be performed to improve fluid dynamics in the central nervous system. And visceral manipulation is also beneficial to improve organ function. Then you have to remove psychological toxins as well. So 20-minute writing exercise to overcome post-trauma might be helpful here. Family constellation work to resolve transgenerational issues. Applied psychoneurobiology to resolve conflicts and severe trauma. Regular time that you spend in healthy nature, regular massages and walking in nature. Endurance fitness, Qigong, Tai Chi or meditation. Pick whichever one works best for you. Then also a detoxification of heavy metals, biotoxins, must be performed to reduce the toxic burdens and eliminate immune system and allergic cellular responses. Also important is to treat dysregulated physiology and biochemistry, to eliminate parasites as a first step in antimicrobial therapy. Immunomodulation to reduce allergic host responses, as well as antimicrobial strategies are crucial here. So now let's go into more detail about each one of those points that you've seen on the previous slide for a successful Lyme disease treatment. First up is biotoxins and heavy metals detox. So Lyme patients often show a heavy metal toxicity, very much aggravated additionally by EMF, and therefore you must first shield up EMF, for example by only using wire internet or wired internet. Also the Vita chip on electronic devices is very helpful. That you can get the Vita chip also at lyra.com. I will post a link in the description box below. Very helpful with your cellular phones as well, and also the TrialMed CGI is very useful here, and I will post a link to this one as well. For a correct detox treatment, the first step is to protect your kidneys. Those are the most vulnerable organs in the human body, and by redirecting toxins to the gastrointestinal tract and circumventing the kidneys. The detox strategy here is to have products penetrating the cell walls, which are nanonized, and toxin-specific binders to transport the metals to the gastrointestinal tract. Prior to doing anything else, it's important to remove intestinal biofilm with 1 tablespoon of green clay, followed by 1 tablespoon of fiber laxative for 6 weeks. Possible remedies to detox the heavy metals. There are many that have proven themselves to work very well and are natural. First up is chlorella of different kinds, Eclonia cava, freeze-dried garlic, green clay, zeolite such as zeobind, microsilica, silicic acid, silica from horsetail tea, cilantro, curcumin with ginger and black pepper in coconut oil triggers also cell release of HDMPB. Propolis, especially the Brazilian green propolis, EDTA or DMSA and DMPS chelations, humic and fulvic acid mixed with acai, plums, pomegranate, and vitamin C from rose hips. Melatonin is a good brain detox product, specifically for mercury. You can mix it with melatonin with the propolis extract also. Use also of hyaluronic acid combined with cistus incanus to break the biofilms is very helpful. You can also cleanse the gut periodically with colonics. You can also use lymphatic drainage and rhythmic cranial and liver compression, dry skin brushing and warm cold alternating showers. Swedish sauna and Toxaway ionic foot bath helps also, and of course the bioscan SWA to determine the precise homotoxins, the heavy metals, the minerals and vitamins, and your deficiencies, as well as with amino acids. So a very helpful tool, and I'm gonna of course link in the description box below as well. So after you've successfully detoxed, the next step is to balance the dysregulated physiology and biochemistry. Here you can do assessments via lab work to correct what is missing and what is too much. So here you look at hormones, minerals, electrolytes, glutathione, sulfur, etc. You can also do genetic testing to find minimal bypass nutrition to correct for SNPs or gene deletions and mutations. Common deficiencies in Lyme disease are magnesium, so it has to be given transdermal or dermally or via injections. Oral magnesium feeds unfortunately SPIROCHETS. Then also copper, zinc and iron are used by the macrophages and appear in oxidized form in your hair and serum, giving the wrong appearance of excess. Lyme patients have also an insulin resistance very often and need to go on a strict ketogenic diet with intermittent fasting to control their blood sugar. In this case, supplements with berberine and niacin or niacinamide are essential. Lyme patients also often have hypothyroidism and thus must be receiving a therapy to normalize their T3 and T4 values. Sexual hormone disorders are also very common in Lyme disease patients, and they can be best balanced with herbs, with the exception of DHEA and progesterone. Also, gastrointestinal disorders are common in Lyme disease patients of different kinds here. You can support colon cleansing, you can detox the liver here and gallbladder with milk thistle, gelum forte. And you also can support your pancreas with pancreatic enzymes as well as the kidneys. Lyme patients also show immune weaknesses, and therefore supplementation with vitamin D3 with up to 50,000 units per day is very, very helpful. Also, you can do no harm, on the contrary, by adding daily supplements to your diet, such as vitamin B complex, niacin with flush, L-carnitine, Q10, EPA, and DHA fatty acids, sulfur, also called SDS, phosphorus, such as lecithin, to support your nervous system, turmeric, oregano oil, which is a very good mold and yeast therapy, probiotic with prebiotics, milk thistle to support your liver, strophanthus for your cardiovascular system, 5-MTHF for your brain, chlorella and spirulina for your detox efforts, maitake, agaricus, and cordyceps. Those are all fungi that support cellular debris elimination. So mushrooms, actually, not fungi, excuse me. And the regular parasites detox, colon cleansing, and liver and gallbladder detox are, of course, always good. Royal jelly helps. Hydrolytic enzymes are very beneficial, as well as adenosyl methionine. Next, we have to talk about HPU, or HEMOPYRROLLACTAMURIA. So over 80% of Lyme patients have developed HPU. The term is falsely used in most US literature as KPU, cryptopyrroluria, but the correct term here is HEMOPYRROLLACTAMURIA, which is HPU. HPU disarms the immune system by catastrophic depletion of zinc, manganese, arachidonic acid, histamine, and taurine. Those losses are hard to detect with any current technology. Only bone and CNS biopsies are reliable here, and I use a 24-hour urine sample that I keep in a fridge, and 1 capsule per day of core from BioPure, which balances zinc, B6, chromium, biotin, molybdenum, as well as taurine. Labs that you can consider to perform this test is HPU, KPU urine test, alkaline phosphatase, low is normal here, copper zinc ration greater than 1 in hair and urine must be searched for, low omega-6 in red cell membrane, fatty acid tests, and white blood cell zinc and red cell copper level should also be considered in the lab tests. If the KPU is treated first and the system is restored to normal levels, which takes about 4 to 8 months normally, Borrelia, Bartonella-like organisms, and Babesia respond to much milder interventions without significant HERGs or other side effects. What else can we do? Well, immunomodulation tests and therapies are very beneficial. Here, Dr. Lewis Thomas already said in 1972 that a response of the host makes the disease and not the antigens, microbes, or toxins. Dr. Richie Shoemaker said in 2010 that the role of the toxin and microbes lies in the initiation of the mega-multiplying response of the host system to a given signal. And spirochets are known to align themselves inside a neural axon, according to Dr. McDonald, and also inside a myelin sheath of the myelinated nerves, also in the lining of the urinary tract, inside the cells of the heart muscles, and outside the cells or in biofilm communities. The over or underactive immune system attacks the cells and other structures that host the microbes, and this is an autoimmune response which leaves the destruction path behind it. And the lab markers to look for overactivity are TGF-beta1, C3a monocytes over 7, IL-1, you also notice in your disturbed sleep this, IL-6, which is stands for low DOPA, TNF-alpha, anti-ganglioside antibodies, and the lab markers for anti-activity are low WBC values and low CD57 values. The use in this therapy phase of homeopathic hemochromatozoles for Borrelia strains that are causing the Lyme disease and for all the co-infections is very good. And in the last phase also the nozoles to treat EBV, HHV6, CMV, HSV1 and HSV2. Consider also an auto-urine therapy, especially for the KPU therapy, to increase the natural killer cells activity. When your CD57 is below 100 especially, consider also different kinds of chlorella. And to increase the macrophages activity, consider GCMAF and rerum suppositories. Another thing you can do is reduce the anaerobic pathogens with RIZOLS and reduce the pathogen counts with ozonated plant oils, also called RIZOLS. RIZOLS have strong and specific antimicrobial properties, no known adverse long-term effects, and are relatively inexpensive and pleasant to take. On top of that, they have been used successfully since 1905. They treat parasites, mold and anaerobes, and here you can treat it with Rizol gamma. Effective dose is 20 drops. Treat both RNA and DNA viruses with Rizol zeta, 20 drops here as well. When on full dose of gamma and zeta, you can treat babesia. CDS is good here, 15 drops, 1 hour apart, 2 days in a row, once weekly for 4 to 8 weeks. After 2 months of the full treatment, you can stop or reduce the Rizol gamma and treat Bartonella with Rizol MY, 20 drops here as well. After 2 months, you can reduce the dose of Rizol zeta and Rizol MY to 10 drops and treat the SPIROCHETS. Here you can therefore add Rizol epsilon and iota, 10 drops each, and always follow Rizol with absorbents for the bioabsorptions, which are, for example, chlorella, 20 tablespoons, chitosan, 1 to 2 caps, zeolite, 1 tablespoon, or charcoal, active charcoal, 2 caps thereof. Why do Rizols work so well? Well, Rizols mimic actually the endoperoxide in plants. Ozonides transfer oxygen and change the pathogen's environment into an aerobic one, and which is an adverse milieu for anaerobic pathogens, and therefore they cannot proliferate anymore. The oils are surface active, moisten the intestinal mucous membrane where the parasites, fungi and bacteria nests are located. Rizols are also acting extra and intracellularly, as Rizols constituents were found in and outside the cells. They do not damage the mitochondria, are not mutagenic, previously damaged and tumor as well as tumor cells are destroyed by them, and there is no adverse pharmacological effects that have been found in cell cultures with Rizols. Rizols and other ozonides have a similar structure with plants endoperoxide groups and are compatible and act in the same direction, therefore. So, some herbs that have those Rizols in them are Artemisia annua and its natural derivatives such as artemisinin, Artemisia vermouthart, Alpinia japonica, Achillea linguistica, as well as Anthermis nobilis. Let's talk a little bit more about antimicrobial therapy, and here especially about Artemisia annua, also known as wormwood. It is the leading herb in Lyme disease therapy. Dr. Yu Tu and Dr. Bill Campbell, as well as Professor Satoshi Omura, received a Nobel Prize in 2015 for their work on using Artemisia derivatives for the treatment of parasitic infections. With a group of scientists in Germany, we here at Lyra Nara succeeded to prepare a patented, unique preparation of Artemisia that has a highly bioactive artemisia extract, which is 25 times more concentrated in artemisinin than all the other products on the market to its very concentrated forms. It shows a phenomenal bioactivity of over 98%. No other preparation of artemisia can give you that on the market today. Using this extract, which contains also additional other herbs that help the proliferation of artemisia within your body, Lyme disease and co-infections along with parasite infestations can be bitten and resolved in the shortest time, which normally takes 2 to maximum 6 weeks. The therapy is easy to carry out at home, is free of risk, no Herxheimer reaction or any other side effects. You administer this artemisia extract orally, so you don't need the injections or IVs. The patients report to us that they feel immediately much better and their health and well-being improves from day to day. And usually after a period of 2 to 6 weeks, as I've mentioned already, their Lyme symptoms are gone, and after 6 months the antibodies and tests for Lyme disease and its co-infections are back to normal as well. So more about our Lyme therapy protocol with artemisia. So our exclusive artemisia herbs extract comes in 25 ml bottles. It must be kept refrigerated all the time. The number of bottles necessary to heal a Lyme disease depends on your health condition, your co-infections, tissue damages, as well as the disease stage. The minimum quantity is 10 to 20 bottles for a period of 10 to 20 days of therapy, so 1 bottle per day. This is realistic for early stages of Lyme disease and after good preparation of the patient, so which means what we talked about already, detoxification, parasite cleansing, and immunomodulation therapy first. The maximum quantity is 42 bottles that will cover 6 weeks therapy, with a pausing time after the first 21 days for extra tests and evaluations of your health. Then a preparation is 125 ml bottle per day that you split into 4 portions of 6.25 ml each, so about 30 to 50 drops 4 times a day. And you dissolve it into 4 ounces of water. Best is distilled or reverse osmosis chilled water, and you consume it immediately or maximum 10 minutes to avoid oxidation of the plant extract. Very important for successful therapy is also to secure a high level of iron, Hem or ferritin, which works as a catalyst for the herb's bioactivity, and usually women must have ferritin close to 200 and men close to 400 Ng per milliliter of blood. The supplementation with iron must also be continued during the therapy using fluorides. These must be taken in the evening before going to bed, and pay also attention to have 8 hours between the fluorides intake and the herbs extract intake. So on top of that, what else can you do? Well, there are other optional herbs therapies. First up would be Smilex glabra or Sarsaparilla, indicated to treat leptospirosis, Treponema pallidum or syphilis, liver flukes, Shigella, and Salmonella common to Lyme, leprosy as well as TB, Lyme endotoxins binding. It's a modulator also of the immune response. It's good for arthritis, psoriasis, neuroprotective crossing brain barrier, pain relief, improves your liver function, your cervical spondylosis, and is known also for reversals of the cognitive impairment. So very good. Next up would be Antrographis paniculata. It's indicated for rapid excretion over kidneys, anti-spirochetal as well, protects your heart muscle, it's anti-inflammatory, it's calming, it's a potent modulator on the mast cells and neutrophils, enhances also your liver function, it's a significant protector against the neurodegeneration of the brain, good for your spinal cord, CSF. It supports also the therapy against malaria, leptospirosis, hepatitis B, C, TB, tonsillitis, pneumonia, herpes viruses, mumps, gum disease, as well as AIDS, cancer, and leukemia. So very beneficial as well, this herb. Next is red root, very efficient for lymph drainage and has antimicrobial effects in your lymphatic system as well. It's also indicated to treat Babesia, Ehrlichia, and Anaplasma. Polygonum cuspidatum, also known as Japanese knotweed, is also very good. It's indicated for leptospirosis therapy, Treponema, denticola, Bartonella, antiviral properties also with this herb, hepatitis B and C, very good for it, anti-inflammatory and antimicrobial effects. It protects against microbial endotoxins, it increases microcirculation, decreases also blood viscosity, it lowers cholesterol and lipids, it increases your wound healing, your angiogenesis modulator, it's a potent antioxidant, inhibits prostaglandin E as well as nuclear factor kappa B. It's good for leukemia, psoriasis. Positive effects also have been observed against Alzheimer, Parkinson, MS, and ALS. It reduces autoimmune reactions. It's neuroprotective. It increases bone mass. It has anti-aging effects. Stimulates the fibroblast and is used also to treat rheumatoid arthritis and leukemia. Next, what you could take is rock rose or Cistus incanus. It's indicated to break the cysts, to prevent tick bites. It opens biofilms and has antimicrobial effects and is very, very good for healing in general. The Stevia ribodina whole leaf extract has a better therapy efficiency than any other antibiotics that are used for eliminating Borrelia burgdorferi, Spirochets, and persisters. And to be also considered are astragalus, samentum, cumanda, berber, nettle, parsley extract, allicin, dragon's blood, cat's claw, oregano tea, as well as cetrodiol. So now that you've heard in detail how you can detect Lyme disease and what natural remedies are out there, let's come to some conclusions and sum this all up so you can remember it better. If you are infected by it, you already know it. For the other people that are not infected by it yet, it's a very serious and debilitating health condition, the root cause for many other multiple chronic disorders such as cancer, MS, dementia, autism, diabetes 2, and many more. It's caused by spirochets, specifically by different Borrelia strains. They're following an insect bite, often a tick bite. The fluid exchange during the pregnancy, it can also be transmitted. Lyme comes with different co-infections such as Bartonella, Babesia, Ehrlichia, Mycoplasma, Microfilaria, and Chlamydia. Lyme also attracts different opportunistic infections such as parasites, fungi, viruses, EBV, herpes, CMV, and many more. It's considered also to be a biowarfare tool and continues to be studied as such in different military and CDC labs in the US, for example. Unfortunately, it's showing also a multitude of symptoms depending on the health condition of the patient, your lifestyle, your age, the stage of the disease. Some general symptoms, though, to remember are fatigue, loss of memory, and cognitive impairment, joints pain, poor sleep, hormonal disorders, dysfunction of major organs such as the kidney, the liver, and the gallbladder, anxiety and mood swings, and Lyme also mimics a multitude of other diseases such as lupus, rheumatoid arthritis, schizoaffective disorders, MS, ALS, Alzheimer's, Parkinson's, polymyalgia rheumatica, Addison's disease, bipolar disorder, CFIDS, myelopathy, polyneuropathy, brain tumors, encephalopathy, neuritis, depression and anxiety, anorexia, dementia, and many other conditions and their symptoms. Lyme disease is therefore very difficult to diagnose correctly, and we've talked about the different tests that are necessary to correctly diagnose this disease and the co-infections that come with it. The number of infected people is very often therefore underestimated. Lyme today is unfortunately the fastest growing infection vector, and the numbers could be as high as 1 million new infections per year. Lyme disease therapy with antibiotics never has returned any satisfactory results due to relapses of the microbes, and successful Lyme disease therapy today is considered to be herbal and is associated with a multitude of different supplements that we talked about in detail, as well as immunomodulators and synergistic herb mixtures. The holy grail among all of these herbs is, of course, Artemisia annua, wormwood or sweet Annie, also its name, and you can get this exclusively at Lyra Nara in this unique high concentration and bioactivity. And I'm gonna post, of course, the link down below in the description box. And I would like to close this presentation up by saying that, in our opinion, Lyme disease has one cure that is better than all the other ones, even though, as we have mentioned in this presentation at length, there are many, many cures that work together very well and enhance each other. But the queen or king of all of them, in our opinion, is Artemisia. And today we offer an absolute cure, we would call it, for Lyme disease. And that is using our unique Artemisia herbs mixture extract that has a bioactivity of over 98%. And we make these claims only for our product, by the way, and do not recommend other Artemisia products that have a low concentration of only 1 to 2% artemisinin and therefore very much reduced bioactivity. So only here you can get a 25% concentrated Artemisia extract that we guarantee you will help you with your Lyme disease better than anything else. It does not matter which Lyme stage you are in, how bad you feel, how many co-infections you have, and how grave your symptoms are. Our product cures your Lyme disease in 2 to 6 weeks. We guarantee you that. It is a treatment that is also free of risk and side effects. You cannot do anything wrong. You can do it at home. You will feel better from day one. And the protocol is very easy to follow. No mistakes are possible. We also recommend to use some frequency devices that you can also get exclusively at lyranara.com, and I'm going to post, of course, the links in the description box below to those. They support very well this Artemisia therapy. They will be the aquatone, which helps detox, enhance the microcirculation, pain relief, and increases fibroblasts. The Geno62 to adjust your biochemistry and balance your autonomous nervous system. Also comes with a specific Lyme disease therapy card. Then Triomed CGI is very good. It's a very efficient shield against electromagnetic fields, as well as the Tau Medical, which is an automated TCM acupuncture diagnostic and therapy tool. It's also very beneficial for you to have your own bioscan for easily testing 250 parameters of your body fluids, including HEMOPYRROLLACTAMURIA, mineral and vitamin deficiencies, and you can also monitor your healing progress very well with this device to dynamically determine what may be necessary to better modulate your therapy according to your needs. And with that being said, I would like to thank you for your attention. If you've enjoyed this presentation, of course, share it with your friends, like, share, and subscribe. And until next time, stay healthy.